Doctors Without Borders this week hosted the 2024 Southern African Scientific Days. Now, this event highlights innovations in medicine and the new approaches the organization is using to deliver services to people in the countries where they operate. To discuss this, I am now joined by Luis Neira, who is the MSF Head of Mission in Eswatini. Dr. Neira, good to have you on the program this afternoon. Firstly, could you elaborate on the significance of hosting the MSF Southern African Scientific Days in Eswatini this year?
Good afternoon, and thanks for inviting me. Yes, sure. We just had our scientific day organized in Eswatini this year for the Southern Africa region. It took place on Thursday with the participation of many people from researchers from inside MSF, people invited from outside MSF, and a presence from different stakeholders and Ministry of Health of Eswatini as well. The Scientific Day in MSF is a platform. It's an event that MSF organizes once a year in different regions of the planet, especially in the regions where we have operations. And it serves as a platform for scientists and researchers to present their findings, their outcomes, and the work they do in different health topics that help to improve our quality of care in our projects, and not only in our projects, but that can also give ideas for innovation and improvement to ministries of health, to other stakeholders, to other actors in the humanitarian world and in the health areas as well.
So let's look at the theme of this year's MSF Scientific Days. It includes tuberculosis, sexual health in precarious settings, but also diagnosing acute early HIV. Let's speak about how do these themes really reflect on the current healthcare challenges which are faced by MSF in the region, but also specifically in Eswatini.
Yes, precisely. These topics were chosen for this year presentation in Eswatini because these are the areas where we are working right now in Eswatini in our mission. No? So we are focusing especially on sexually transmitted infections. We just handed over a project that ran for 12 or more years in the south of HIV, but we are still receiving some cases through the STI cases that we see in our clinic. So that's why we chose these topics to be presented, to have some results that would help us definitely to bring, as I said before, innovation in our projects and improvements, and to reach better our populations that we are taking care of.
Dr. Neira, I must say that it's quite commendable that MSF places importance on really engaging patients and populations as partner initiatives. Could you share some examples, if you will, of how the MSF has successfully implemented this approach in Eswatini, but also the resulting impact on healthcare outcomes?
Yes, absolutely. This is an important approach that now we are putting too much accent in our projects in MSF, to engage with communities, to get a better insight of what are the problems, to involve the communities into the design of our projects and how better can we respond to their needs. So what we do is exactly that, is to approach communities, to approach groups that work with our target populations, to meet them on a regular basis. One example is a roundtable that we run every 3 months, every quarter of the year, with all the stakeholders, all the actors that are involved in the activity that we do. So what we do is to listen to them. They can explain how better they would like the services to be offered, what would be the best timings for them to come to the clinics, what are their barriers and complications that they have to reach us. So in that way we can improve. So it's something that now we are putting, as I said before, too much efforts to engage with communities and actors to bring them closer to us and to work together actually as partners in the delivery of healthcare for them.
Let's speak about the newly opened clinic in Eswatini. It's called Sitsanziwe, or We Are Loved, and focuses on providing sexual health services with this key focus on vulnerable populations. How does the organization then ensure that these services are accessible and culturally sensitive to these diverse communities it serves?
In part is what we just spoke about this engagement with communities, to come and work directly with them, to listen to them, to sensitize both our teams who work with the communities on the diversity and inclusion that we should have in our projects, on the respect for the human being. And also through our Department of Health Promotion and Health Education, we reach for the people. We try to promote our services, to educate the people on the importance of having these services, of coming to the clinic on time when there are health issues related to the services we provide. And to definitely to welcome them in a warm and comprehensive way, so they feel comfortable to come to our services. No, the fact that the services are totally free of charge, that people don't have to pay anything for the services that we provide, for all kind of services we provide, is also a way to engage people, to invite people to come to our clinics.
I'm sure you'd agree with me that collaboration with the Ministries of Health is quite crucial for achieving sustainable policy change. Can you then discuss some of the key areas of cooperation between MSF, but also the Ministry of Health in Eswatini, and the outcomes achieved through this partnership?
Absolutely. It's totally necessary for good success of our activities and our projects to have a good understanding and good collaboration with the Ministry of Health. And in our case in Eswatini, fortunately, we have a very, very good relation, very good support from the Ministry. As I mentioned before, they were present during the scientific day. But a very good example that you are asking is more than 12 years working in the HIV topic, in the HIV problem in the mission. No? So MSF came here to help the ministry to tackle the emergency of HIV with the high numbers that were present in Eswatini. And for around 12 years working together with the ministry, the results were amazing, with a big reduction in numbers of HIV in the area where MSF was working, in the south of the country, Chiselweni area, and to be able to leave activities that the ministry could take over and continue running. It was not only HIV, it was also tuberculosis, with a ward that MSF constructed in Langano Hospital that now is still running and became the referral TB ward for multi-drug resistant tuberculosis in the country. So this is a very good example of how things, when we work together with the Ministry of Health, when we have good collaboration, we can not only provide our services and our support to the populations, but to leave something that can be sustainable and that can be managed by the ministry once we hand over operations.
Dr. Neira, as the head of the MSF, also its mission in Eswatini, what do you envision as the long-term impact of MSF Scientific Days on healthcare delivery, but also policy making in the region? Definitely,
the results of the studies that we brought this year, especially in the areas of sexually transmitted infections and HIV, will help us to improve, to adopt some of these recommendations that come with these studies, to be able to better, as an example, we will implement new ways of diagnosing and approaching the diagnostic and treatment of STIs that came from one of these studies, to understand a little bit better on multi-drug resistant TB and tuberculosis, and new ways of treating with reduced times of treatments, how to engage with populations, how to improve that engagement. So all this information that came out from the scientific days will help us to move forward, to improve our activities, and to be shared as well with the Ministry of Health and different programs and different stakeholders who can take advantage as well of this information and these outcomes, and probably implement some of these new outcomes into their programs and also to try to improve for them. So definitely scientific days bring this possibility to learn new things, to take some or whatever can be implemented in our context, and to improve things there.
As we wrap up our conversation, but also looking ahead, Dr. Neira, how does MSF then plan to continue innovating and also adapting its approach to really address emerging healthcare challenges in Eswatini and even beyond?
Yep, as I mentioned, we stay here in Eswatini. Now we started these new clinics, Itsansiwe, as you mentioned before, tackling now the problematic of sexually transmitted infections. No, our aim for this year is to get this project running, to consolidate and to expand it according to the needs. But at the same time, we are proposing new activities in the area of intensive care with some support to Mancini Hospital with a high dependency unit that is a kind of intensive care for complicated cases. And then in the meantime, we keep having a good relationship with MOH and following the situation in Eswatini and in the area as well, as you mentioned, not only Eswatini, but in general in Southern Africa, to follow what are the main problematics in health, what are the main humanitarian needs, what are the emergencies that one can respond to, and be ready to respond whenever is necessary.
Let me thank you for your time. That's our guest, Dr. Luis Neira. He's the MSF head of mission in Eswatini, for really sharing his valuable insights into the impactful work of the MSF, but also the significance of the MSF Southern Africa Scientific Days, of course being held in Eswatini this time around.